Hello, everyone. The first day of Summit. I'm very excited with this amazing experts today. And we're going to talk about so many things, especially autoimmunity with Selena Rothenberg. We're going to talk about hormone and pain connection with Dr. Deborah Methew. She's going to come and join us today. We have pain relief with regenerative medicine with Dr. Jordanna Quinn. She's here right now. Heal the gut, heal the autoimmune disease with the star pen. And she's a leaky gut coach. We're going to talk about retrain your brain to eliminate pain with Dr. Iren Kopp. And then we have functional lab testing with Dr. Daniel Cardilicio, right?
That's
And
good
then
enough.
we do, yeah, metabolic chaos with Reed Davis. Again, he's going to join us today. We're going to talk about activating your gene with Kelly Lupsha and Dr. Kelly Lupsha, and then hormone imbalance and fertility, Dr. Tara Scott, and again about the leaky gut, how leaky gut leads to chronic pain with heater gray. Be with us. We gotta have so much fun today. All right, we are back. Uh, I guess somebody has a microphone on. I try to mute everybody, then we can talk one by one. All right, I'm very excited actually. I was waiting for this summit for a long time, and I can't wait because that's a great topic, chronic pain. And so many people have it. So many people suffer from fertility, asthma, autoimmunity, and they don't know how to recover from it. And they have lots of challenges. They take pills for a long time, but still they are not on the right path. I want everybody introduce themselves, and then we start from different topics and we dig into it. Okay, we start with Dr. Tara Scott. She's a medical doctor, hormone guru, and she's also a gynecologist. She's a bestseller author right now. She wrote one chapter in the Gap, and if you haven't read it, go and find it. It's a great source for whoever suffer from chronic disease. So I want you to just summarize your introduction, like to few sentences. All right.
Sure. I'm a traditionally trained MD. I got my start in OBGYN and saw a need for a specialization in women's health, focusing on hormones. So I became a certified menopause practitioner with the North American Menopause Society. Went on to do further training in functional medicine, getting a board certification from A4M and a third board certification in integrative medicine. So now I take a root cause approach to women's hormones, even male hormones, as it pertains to thyroid, adrenal, stress, infertility, menopause, perimenopause, fatigue, and just wellness with women mostly, but also men as well.
Amazing. All right, we go to Selena Rothenberg. She's also bestseller author. She also wrote a chapter in the Gap. I love talking about autoimmunity, especially for children, because what's happening, we cannot give everything to children, right? Especially for the supplement, the even for the functional medicine. I know a lot of audience have this question. We're going to talk about it later, but right now I just want you to introduce yourself.
Sure. Hi, yep. My name is Selena Rothenberger, and I am a functional medicine practitioner. I also have certification in nutrigenomics and autoimmunity. And I got into this whenever my oldest son was diagnosed with autoimmunity after we thought we were doing everything right. And in that journey of trying to find answers, it became pretty evident that I need to help others, because there's a lot of other mothers like me who are been asking their physicians or their other health providers for years about symptoms, and they just can't connect the dots. So I help others to connect the dots and take those pieces of their health puzzle and put them back together.
Thank you so much. Kelly Lupshaw.
Hello, everybody. Welcome. Thank you so much for having me. So my background is I've been in medicine and healthcare for over 25 years, traditionally as a physical therapist. And I've specialized historically in treating stroke, traumatic brain injury, concussion, and very ill neurological diseases. And about 13 years ago, when my father passed away of cancer at 69, I really took a deep dive behind the reasons that he even acquired cancer, because it was not in his family history. And through that, I really realized that we're really more in control of our health than we ever thought through activating our genes. And our lifestyle plays a huge role in our genes being able to express themselves for good or bad. And so now I am a women's longevity health expert, helping people really recognize that they can take control of their genes and activate their pathways of their body to live a much healthier, long life.
Thank you, Kelly. For my audience, you don't know Kelly because we never had interview together, but we're gonna have another individual interview with her. So we're gonna go into detail what she's doing as well. All right, Dr. Jordanna Quinn. She's a bestseller author in one of the chapters in Gap. Welcome to this show, and I want you to introduce yourself in a few sentences.
Here we go. So I'm a physical medicine and rehab doc by training, and got into the regenerative medicine space using body's own platelets and stem cells to help heal from orthopedic injuries. And from there, discovered the whole world of anti-aging medicine. And so much like some of the other practitioners on here, really find value in treating the whole person. So I see a lot of high performers and high-level athletes who want to optimize their health and live as long as possible with a high quality of life. And so we focus not only on healing the patient orthopedically, but also, in all of lifestyle modifications with diet and stress and lifestyle, and how to, live their best life possible.
Actually, with in the Gap, we have 3 doctors who do regenerative medicine. One of them is Dr. Jordanna Quinn. Dr. Tara Scott do the regenerative medicine. We also have Dr. Daphne Neyman. She's gonna be here on April 7. I really like regenerative medicine. They talk about this in different chapters, and the reason is because science changed everything, right? And especially right now, we're going to talk about functional medicine, regenerative medicine, everything together help people to find the root cause of their problem, so they don't need to only take the medicine. I'm not denying the medicine, we need it, but our body needs to be prepared to have any other kind of recovery.
Well, agreed.
So,
and I think taking the least invasive approach possible at first. I always tell my patients the best possible outcome they can have from surgery is to say they wish they would have done it sooner, right? But if they see me, not that, I'm not necessarily going to send them to surgery, but if we can do injections and things like that to help either prevent surgery or delay it, then they can have a better outcome. Because once they have a knee replacement or a surgery of some sort, you're increasing your path of arthritis, and you're changing your anatomy, and you can't go back from changing anatomy. So
exactly. Yeah, we're going to talk about all the topics, and hopefully we have enough time to talk about it. But right now we're going to introduce Dr. Iren Kopp. Am I pronouncing your name correctly?
Yes, you did great. It's Dr.
Yes.
Iren Kopp.
All right, can you introduce yourself? That's the first time I see her, and I'm very excited. Again, we're going to have another individual podcast with her to be more aware of what she's doing. But today, um, because of the chronic pain, we are here and we are gathering to dig into this topic.
Mm, thank you. So I am Dr. Iren Kopp. I am CEO and founder of the Stress to Success Shift Institute. And I help purpose-driven high achievers to shift from stress to success in all areas of their life, their career and wealth, their health and energy, their relationships, their personal life. And it's all based on, it's functional medicine coming at it from the power of the mind and understanding that we all need to keep upgrading our operating systems, or perhaps we have glitches in our operating systems that make us more prone to conditions like chronic pain, autoimmune conditions, diabetes, heart disease, cancer, and that it's important and crucial, and it's a crucial missing piece of the puzzle to clear those glitches that
Exactly.
are dragging you down as far as your energy so that you can heal.
Yes. All right, Dr. Daniel Cardeliccio.
That's very good. So I want to thank you for inviting me here today. It's such a distinguished panel. By training, I'm a chiropractor. However, at one point in time, I had a lot of offices throughout the tri-state area in the Northeast United States, and I had a heart attack, and I didn't know where to go, didn't know what to do, traditional medical route. I was a D1 athlete, and I went from 195 pounds to 260 pounds over a period of time. And I found a functional medicine practitioner, and I said, wow, I really love this, and I want to do this. So I went for a master's degree. I'm an adjunct professor. Right now, my practice, just like everybody else here, is finding root cause. I look at the gut. My topic's going to be functional lab testing. For whatever reason, I just love lab testing. I love to look at the data, and I like to make the recommendations, and I love to get people better. Thank you.
Thank you, Daniel. Daniel also has a podcast, and I've been there. I love it. Yeah, and again, I'm gonna have him in my podcast individually to introduce you what he is exactly doing. Star Pen, go ahead. Are you mute?
Yes.
Yeah.
Hi, I'm Star Penn. I am the Leaky Gut Coach, and I 7 or 8 years ago now, I found out my daughter had juvenile arthritis, and I healed her by healing her gut. And since then, I then became certified as a health coach, and my goal and my passion is to help as many people as possible to heal their autoimmunity by healing their gut. Right now, I have a program called the JIA Blueprint, where I help moms of children with JIA. I help them to feel more confident, to have less stress, to be more knowledgeable about this subject, so that way they can be the best possible versions of themselves for their family. And so that way their JIA kiddo can go ahead and thrive and have a vibrant future.
Beautiful. So I'm going to introduce myself. I didn't, right? I'm Panta Kalhor. I'm a podcaster, YouTube show host, and I also certified fertility coach and PTSD coach, and 5 times bestseller author and publisher, right? So I see in this panel we have a few functional medicine. I just want you to raise your hand, whoever is doing functional medicine here. Can you? Yeah, great. So I'm gonna tell you a story about the functional medicine. Like for the asthma and my fertility journey, I really found the power of integrative medicine, not only in functional medicine, but in acupuncture. And I knew that something is missing in conventional medicine. If your body is not ready to accept the remedy, so nothing gonna happen. You agree? I see all of you have some personal story about functional medicine or your health issue, because that's the point. When you have health issue, you go and learn to your body, or when you have your child with some problem, you try to find a clue what's happening to her. So I want to hear your stories one by one first. So try to summarize it. I'm gonna see what happened to you when you decided to change to function. I'm not saying change, but to learn functional medicine. Who is going to talk first?
I'll go first.
Okay, go ahead, Salena. Go ahead.
Yeah. So for me, the journey happened back in 2014 when my oldest child was diagnosed with type 1 diabetes. There's no family history of that in our family, either side. Up until that point, we thought we were doing everything right. We made our own foods. We ground our own flour. We had a lot of natural organic foods. However, he still developed diabetes, and he had a lot of chronic health issues from day one. From the very first day he was born, there was something. He had GERD. It developed into chronic GI issues and respiratory issues, ear infections, skin. The list goes on until it led to autoimmunity. So when we were at he was life flighted to Dallas Children's when he was in DKA, it was at that point, I'm like, there's got to be something different. Like, this entire time we had lost 4 pregnancies prior to him. So there was a lot of infertility that we suffered with, and it was like enough was enough. So I spent about a year looking literally across the US at different practitioners trying to get answers. And our family physician was wonderful here. And he's actually now in functional medicine, but he's like, you're not going to find answers in traditional medicine. We're just not trained that way. So he helped me to take that step to get further into functional medicine, to get functional medicine training, to help my son. The two of us together worked really hard. We've pretty much reversed everything of his chronic health. He still has his type 1 diabetes. He went with over 2 years of a honeymoon period, but the change in his overall health is just absolutely dramatic. And so that was what got me into it. And then, like I said earlier in my process, like, there's just so many other mothers that I know were like me, that there's something wrong. But we're told in conventional world that, oh, it's just normal. And we have to redefine what normal is. And my mission has become redefining healthcare. We have to get clarity, be able to take action steps, and have the right resources so that people can be empowered to actually take control of their health and live a one that's full of vitality and wellness.
Beautiful. Thank you, Selena. So we have here 2 more people. They haven't been introduced to you yet. I know Dr. Deborah Methew very well, and I work with her. I love her topics. She has a book about the hormones. She has 2 books about the hormones, as I remember. And then she's also contributor of my another book, Naturally Conceived. She's a triple bestseller author. Welcome to my show, Deborah. Thank you for coming. Yeah, I really missed you. I love this panel because I can see everybody. So can you introduce yourself to us?
Sure. So I'm Dr. Deb Methew, America's Happy Hormones Doctor. And I work with men and women to help get to the root cause of why they're having hormone imbalances so that we can get them back to feeling well, get off prescription drugs, and love the way they feel.
Great. And then we have Heather Gray. She's also a functional medicine practitioner. That's the first time I have her. And as I said, if you later, we're going to have another individual podcast with her to go to more details, but I'm very honored to have you here, Heather. Thank you.
Thanks for having me.
Yes, can you introduce yourself?
Yeah, I'm Heather Gray with Discovering Health. I'm a functional diagnostic nutrition practitioner. I know that's a mouthful, but I work with folks who have autoimmune issues and mental health stuff. So again, more root cause, right? Getting to the bottom of why it is that you're reactive and angry and moody, depressed, anxious, and in a lot of pain.
Amazing. I thought I'm mute. All right. So So what we're doing as we take turn and we talk about functional medicine, because a lot of people here are doing functional medicine or kind of holistic medicine. Salena talked about her own autoimmunity, her child's autoimmunity issues, and how she found it. And now we're gonna get back to Dr. Tara Scott. She's a gynecologist, and she has a story behind it. And you can actually read the more details in the book, The Gap. Go ahead.
Yeah, so I always had problems with my periods, really painful periods, and finally went to the doctor while I was in medical school and was just given birth control pills, even though I didn't need contraception at that time. So I took those for 10 years. And when it came time to get pregnant, I was unable to get pregnant. I did Clomid, got my first baby, and then after that had 6 failed cycles of Clomid, had a surgery where I was diagnosed with endometriosis, had 4 or 5 more failed cycles until I finally had IVF for my second pregnancy. So after that, when you're done with all the fertility medications, I was also in the process diagnosed with Hashimoto's thyroiditis, and we didn't really look for the cause of anything. And so it wasn't until I continued really having hormone issues in my late 30s that I found functional medicine and started doing that approach by testing hormones, balancing hormones, finding out that I had issues with methylation and estrogen detoxification. And I think if I would have known what I knew now, I might not have had the problems I had with infertility. So I focused more on hormones. And then my brother suddenly had a heart attack at the age of 38 and died. And he had every risk factor. He was a diabetic, he was on a statin, he was sedentary, he was a smoker, he was stressed. And his death was so preventable that it had a profound effect on me. So I started doing more studying in wellness and functional medicine and really focusing more on prevention, still mostly on hormones, prevention of breast cancer. I was able to, when I went on and had more surgeries for endometriosis, by the 3rd surgery I had, there wasn't any endometriosis there at the time. So my experience was that treating my problems with the root cause approach really had an improvement on my endometriosis.
Beautiful. Okay, who is the functional medicine? Daniel. I know he's gonna talk about lab testing. Reed Davis should be here by now, but I think he's late a little bit. But he also wrote about lab testing in the book. All right, Daniel. I know you already introduced yourself. What happened to you? You decided to go to functional medicine path.
So I'm 60 years old now, and when I was 37, I had a heart attack, and I had metabolic syndrome. Went the traditional medical route, taking Tricor and Lipitor, every type of core that you can think of. And it did lower some of the blood chemistries and the lipid panel. And, I was still eating poorly, stressed. I had offices in New Jersey, New York, Connecticut, for those of you here who've heard my story. And I was just eating a lot of fast foods because you're going from office to office. So you would come out of one office and there was a fast food place, and I would just go in. There was a hot dog place on the Bell Parkway in Brooklyn. Every Friday at 1 p.m., there were 3 hot dogs and a can of Coke that was waiting for me. I went to the front of the line. I put my buck down. I went like that to the guy, and I just ate in the car. And by the time I got to the office in Suffolk County, Long Island, I was hungry. So of course I had pizza. And so my relationship with food was, to say the least, unusual. And what happened was, after the heart attack, I became more frustrated. You lose 10 pounds, you gain 5 pounds back. I went to a functional medicine doctor, and they did some interesting blood work. They did some food sensitivity tests and other different types of tests that we can get into later on. And I was eating some good foods that were really good for my biochemistry. And I started to lose weight. And, I started to feel younger again. I felt more vibrant, more energetic. so that was my foray into it, and it still burns today to help people. My son has ADHD, and we're looking, we've looked at his gut, and he's doing significantly better after, a bunch of lab tests. My mother's been, she has lung cancer right now, so we've been looking at her, and we're helping her out. So I think a lot of us have personal experiences, and I must say, and I would be remiss if I didn't, stress levels when you're running multiple businesses are always a lot of fun, and that's what perpetuated the eating. And I took Dr. Irene's course, and it helped me out significantly. And so I said to her, I said, I'm in with your business. She said, "Oh, really?" I said, "Yes." And so now I'm like the international director of business development for the Shift Institute. So I would be remiss if I didn't say that. But, the lab testing, I think for me, really saved my life.
Yeah. Yes, exactly. That's what happening to us as well. And we already had this experience. So who is going next? Kelly?
Sure. Thank you so much. Yeah. So, my journey really, as I said in the introduction, happened to me when my father ended up passing away of cancer, and really realizing that so much of, just like all of us, traditionally medically trained. I got my physical therapy degree actually from the Mayo Clinic, and it was very, very traditionally trained. And I was like, there's got to be something under the cover. There's got to be more. And really, it started my journey about looking at everything from toxins, chemicals, pollutants, everything that's been in our environment. And of course, we're all aging, and that was like a given. But I even saw in my own communities and my practice, why are we having more autoimmune on the rise, more chronic pain on the rise, more cancer on the rise? Yes, we're aging, but what else is different? And the world we're living in today, especially in the United States, is so radically different than it was years ago. So our poor bodies, right, are suffering. So in my journey, I thought I was well, because I took care of myself. But then after I did very, very detailed DNA testing, gene testing, I realized that I had had some really horrible genes, but fortunately I was doing the right behaviors to keep those genes off and not on. For instance, I actually am homozygous for the celiac disease and should be very, very sick. But I had learned about how to boost my mitochondria in pathways. I had learned how to upregulate the NRF2 pathway and regulate all of these genes of detoxification and inflammation and boosting our own antioxidants and glutathione. And I was like, wow, I didn't know I had the gene set I did. Empowering people, I think people get scared to know what their genes are, like, oh, I don't want to know. But now that I know, I can be even more impactful on leaving the lifestyle to prevent those things from happening. So I have a litany of other genes. My husband said, it's a good thing when we married, I didn't know what your genes were. But again, some of the things dealing with brain health in my entire career, here, lo and behold, I also have the Alzheimer's gene. And I thought, what? Me? What? But again, it's just so empowering when we get to teach. We have it, but knowing your genes is like a piano sitting there. But the piano player, right, your lifestyle and how you choose to live your life can be varied on what your choices are. And so I just love that, because truly we are in control, and functional medicine is allowing all of us to just learn so much more, layer by layer, of uncovering what works for me might not work for somebody else. And that's just, that's actually more beautiful than having a protocol for everybody.
Actually, the interesting point, Salena also work on genes, right? And she has interesting podcast with me about the genes. She thought that the genes is the problem for her baby, autoimmunity disease. But the point is, we may not control so many things about our genes, but still we can improve it, right? Improve our health. Yes. So who is left? Reed Davis trying to connect, but I don't know. It's very full here today. Okay. Star Pen, can you continue?
Yes. So what I do is I help moms mostly heal their children's autoimmune disease, but I focus on JIA because that's my journey. And that's what I had to deal with. And I just know when you get that diagnosis and just the fear and the overwhelm and just everything, it just takes over. And you're not really sure what to do because you get so much well-meaning advice from medical professionals, natural practitioners, parents, friends, and family. And so when I learned from a naturopath who really took the time to help me understand the root issue, that the gut issue, which was something 8 years ago, I don't think any of us were really talking about. It kind of seemed like when I started learning about it, it started to become, I don't know if it's one of those things where it just starts to become like right in front of your face. But I honestly thought, because I did not want to go the medical route for my daughter if I could avoid it, like you said, I know that they can be helpful in a crisis situation, a rescue type of situation, but I just knew that I wanted to find another way. And I honestly thought that what I would end up probably having to do was do something raw, vegan, something like that. But then when I learned how the gut microbiome and how that becoming off balance and how that can lead to a permeable gut, when I started to take action on those steps, and I saw my daughter heal, and I saw my entire family heal from things that I didn't even know were really autoimmune, things like allergies and skin conditions. I was so passionate to help other moms to do the same thing. So I became certified as a health coach, a leaky gut health coach, because even with all of you wonderful practitioners here, it's hard to do these things on our own. And so I've put myself in a position as a health coach so that way I work along with your rheumatologist, I work along with your functional doctor, and I help you with the day-to-day and the moment-to-moment struggles and fears and anxiety, and help you to heal your child if you can naturally. But if not, if we're incorporating conventional medicine, that's fine too. I'll help you get that healing.
Sorry, I was muted. I see the allergies. You don't know, but when I did the functional testing on myself, I see, oh, I had some allergies. I had some the histamine issues, and then so many things until you cut with one of these diagnoses that is not really related even to your allergies. So as we see with the functional medicine, we are living in holistic life. So everything should be related to each other. Everything should be really work together. So here again we have Dr. Jordanna Quinn. Yeah. Now we're going to talk about, is there anybody left for functional medicine? Oh, yeah, Heather. Yeah, you didn't talk, right? Go ahead.
Awesome. Thank you. So very similar story to a lot of you folks. Mine though was, I was basically born constipated, right? There was something wrong with my gut at a very early age, and nobody was checking it out and trying to figure out root cause. They were just throwing Band-Aids at symptoms. And so that was kind of the beginning of the start of my health journey and digging deep. So I've been a health detective for a very, very, very long time. And then couple that with some early childhood trauma and undiagnosed celiac disease, which I didn't know at the time, kind of made me a perfect host for Lyme disease when I contracted it at the age of 13. That went 27 years undiagnosed. So I was undiagnosed Lyme disease, celiac, Hashimoto's, endometriosis. Yeah, I think that's it. And, if I was continuing to go the traditional route, I would have died. They were throwing napalm at the Lyme disease, but they were doing nothing to support the host. And it wasn't until I heard actually Reed Davis, who's like my hero, speak on a podcast and talking about how you have to support and heal the gut, how you have to support the hormones, how you have to look at detox pathways, how there's all these different areas in these bodies that you need to look at in order to get true health. And that's why I jumped into this work. My son also was diagnosed with celiac disease at the age of 2. He had 2 stints in the psych ward for suicide attempts. I had 2 stints in the psych ward for suicide attempts. My uncle did kill himself. So this whole autoimmune chronic disease and autoimmune is mental health is very near and dear to my heart. Like it's affected every area of my life. And it's something that I've just devoted every cell in my body to. It breaks my heart to see all these folks out there just, suffering needlessly when the answers 9 times out of 10 are lifestyle. So that's
exactly, that's true. Exactly. It's not only diet or is not only exercise. Everything is related to each other, like sleep, as Reed Davis also said, the dress code that we follow in functional medicine, like diet, rest, and energy, or we do stress reduction, or even the supplements we use. So we also, is there anybody left with functional medicine? No. So we get back to all right, Dr. Deborah Methew. She's a hormone doctor. We had a great chapter in Naturally Conceived about the hormones and mostly about the fertility, but she's doing generally about the hormones. Oh, did I mute
No,
you?
I'm here. Do you want me to tell my story or talk about hormones?
Yeah, you had an interesting story. Please do.
Sure. So my story is that I was exhausted all the time. I loved napping. It was my priority during the day. And I was also really irritable. I used to feel like the worst mom ever for constantly shrieking at my kids. I always felt so guilty. And my poor husband didn't know what to do with me because I was hot and cold and my emotions were all over the map. And the really confusing thing is that nothing in my medical training helped me to understand what was going on with me. I wasn't exactly sick, but I wasn't exactly normal either. And what actually changed for me is that I read a book written by Suzanne Summers. And as a medical doctor, the last thing I wanted to do was get my information from a celebrity, but I had nowhere else to turn. And when I read that book, and I read about all these women how they felt and then how much better they felt when they got their hormones balanced, it really allowed me to open my mind, and it led me to places where I could learn. And I realized that this wasn't woo-woo science. There's real research and science behind this, but because it's not dependent on pharmaceutical drugs, it's not exactly what we were taught at medical school. And so as a result, I got my energy back, my kids got their mom back, my husband got his wife back, and I was able to get my life back. But I couldn't go back to just writing prescriptions all day long the way they taught me. And so now I work with people to help really understand what's going on with their hormones, because we can have hormone imbalances at any age, and hormones are so important for how we feel on the inside, how we relate to other people, how we react to the world around us. Hormones impact our immune system function. They impact our mood and our brain. They even impact our gut function, and they impact our experience of chronic pain. So when somebody has, whether it's arthritis or any kind of a pain condition, there are certain hormones, when they're out of whack, it just makes you hurt more. So balanced hormones are so important for overall health and well-being. And unfortunately, it's just something that's not really well done at all in our conventional medical system.
Yes. As even Dr. Tara said in the book, both of you talk about the hormones. And I see that even people doing hormone therapy, and I'm not saying it's good or bad. I'm not a medical doctor, right? For some people, it's needed, but usually there are it should be other ways that you can balance your hormone, not just the hormone therapy. As we see, we don't treat the paper. We just try to find the underlying issues, right?
Exactly. Because if we can help get hormones back into balance naturally, then you don't necessarily need to have the
Exactly.
hormone replacement. And it depends if you're 65 versus 35. But we really want to put hormones in a healthy body. And so it's really important that it's a whole person approach. And there's so many things that throw our hormones out of whack: too much sugar, chronic stress, not sleeping. And so we have to address the whole person in order for our hormones to be able to do their job.
I'm gonna add the sleep, especially for parents.
Yes.
People who have different, I don't know how they manage to have a few kids, like right after another, because it's so difficult. Like after I have I only have one, but then we thought about having another one. I say, oh my goodness, I can't bear it. Like it's not easy to not like just sit there and not to sleep. I don't know how you guys did it, but for me it was so difficult. Yeah. So who is going to add? Oh, okay. Jordanna Quinn is still left, right? Did you talk about regenerative medicine? Yeah.
No, so I don't have a major story of how I got into it. Other than, to me, I call it common sense medicine. I guess, my story being I've always been an athlete and eaten really healthy, like to the point my mom wouldn't buy us ketchup because it had sugar in it. So we were like all health for a lot of our lives, not our entire lives. So to me, it was just like how I was raised. And also as a competitive gymnast and then a springboard diver, like I was very in tune with my body, right? When things, even I remember getting my period at 14 and like my proprioception when I was flipping and twisting was off. And so like you realize how all of these things affect you, but it was innate in me because it was how I grew up. And so when I went to medical school in traditional medicine, actually before I applied to medical school, I was looking for alternatives because I didn't want to just do traditional medicine. But then in the end, that's what I did. I'm a DO, I'm a doctor of osteopathy, but so when I got out into like real medical world and was just prescribing pain medicines and sticking needles in people's spines, and I was just like, this is not, and begging, like I found myself in clinic begging people to take care of themselves, like talking. I had 30-year-olds that weighed 300 pounds on OxyContin, and they're like, my back hurts. And I'm like, that's not rocket science, maybe lose 200 pounds or whatever, and I would literally tell that to patients. I'm very blunt with people, but people want a pill to fix their problem as opposed to making lifestyle changes. And so, and I had learned about regenerative medicine in residency. And so basically when I found someone who wanted to hire me to do regenerative medicine, I took that job, and he was one of the first anti-aging medicine docs out there. So kind of mentored me in functional medicine and all the things. And to me, I felt like I was home when I found that medicine. I was like, this is what I want to do. Like, this makes sense. Like, talk to people about lifestyle. Like, that is why I went into medicine. Because again, it's always been a part of me. So I don't have health issues. And I watched my grandmother play tennis twice a day till she was 80. Like, it's in my family. To eat healthy and live a healthy lifestyle. And so it really just made sense to me. So it wasn't rocket science. I kind of had the opposite approach of like, this is what I want to do, like in medicine. And this is really what I believe we should all be doing. So that doesn't speak to regenerative medicine other than, using your body's natural healing powers in a concentrated form to heal itself. Speaks to just kind of the natural side of healing. And again, as an athlete, I want to help athletes get back to, I want to help all people, like all of us doctors, but started with athletes get back to, living a life they love and doing their sport more quickly. And now, I do, again, with kind of what Dr. Deb said, and really what everyone has touched on is it all matters, right? I can't just stick a needle in someone's knee with stem cells and fix them completely. Like, we really are talking about their hormone health and what they're eating, because if they're overweight, their knee isn't going to get as better as they want it to be, and so they need to lose weight and they need to eat healthy and decrease inflammation in their body. And that's kind of the long and the short of it. Now I have a course that talks about what you're talking about, Pantea. Like, there's the pillars of health: diet, exercise, sleep, stress are like the 4 major ones. And then, you can do medication management or supplement management, or I've started touching a little bit on, mindset in a lot of my athletes and business owners and things like that as well, because if you can't get over your mental drama, you really can't achieve the next level of health or anything you want. And so that's a really long story, but it really is all related. I kind of started off focusing on like joints and, athletes, and like I've expanded to just, you really have to help people with all of it. Otherwise, you're not going to achieve this life you want. And we're truly all better people when we feel good and we sleep enough and we're less stressed, right? The world's a better place. So that's my story.
Great. So, Dr. Iren Kopp, do you want to add something?
Sure, I'd love to. And that was actually a beautiful segue, Dr. Quinn. Thank you. And I have that Dr. Quinn medicine woman going through my mind, which was, sorry, that was a squirrel moment. Yeah. My personal story was that, like Dr. Dan, I started out as a doctor of chiropractic. I did acupuncture. I was a neurophysiological meditation instructor, actually way before it was a thing in mainstream circles, shall we say. And I was actually 37, like Dr. Dan. What's with that age? And I thought I was on top of the world. And in reality, I had developed catastrophic burnout, didn't know it, and lost consciousness and drove straight into a 3-story rock face in northern Canada. And I broke 10 bones. That's not the worst part of it. My 2 young sons, who were 4 and 6, were in the car with me. And my 4-year-old son had a catastrophic brain injury, was airlifted to the nearest hospital 3 hours away. My 6-year-old son developed PTSD because of what he witnessed at the scene and had adults throwing up. And it was during the first SARS. So COVID is a SARS virus. And so the very first SARS was I was in hospital on quarantine all alone, only able to lie flat because of my 10 broken bones. And my youngest son was in another hospital. I couldn't see him. I couldn't see my 6-year-old son. It took probably about 3 weeks before after emergency life-saving surgery, to decide that my youngest son was even going to live. And so, and my 6-year-old son was being kicked out of school every single day because he was throwing chairs and he was spitting on people and teachers, and he was threatening to hurt himself and others. And I'm hearing all of this third hand. And I literally was just spiraling down in guilt and shame and remorse, and wondering what kind of doctor I was to allow this to happen, to not know what kind of mother was I. Forget the pain. It was the mental and emotional pain that was way worse. And at the same time, I remember, like, literally, I'm in this dark hospital room, bawling my eyes out and crying, why me? Why me? Part of it was why me? Because I did everything right. I was a doctor. I ate right. I exercised. I did yoga. I taught meditation. Whereas I did everything right, and yet I still crashed and burned. And that's when I realized that, number one, I was just a statistic, because even at that time, burnout was a silent pandemic that was accepted and expected, really, truly, by our culture. And as doctors and health providers here, we know that, right? Except for some reason, the message hasn't gotten out there. And now, after the last couple of years, you could say it's truly global, where, just about everybody has been under chronic stress and strain. And so what I recognized was that, with my education and my personal experience then, that I was the perfect one to help others to prevent, hopefully, or recover from what my family and I went through. So that if I could help one family, one person, avoid our fate, then I would be successful. And what I realized also was that I did everything right as far as lifestyle. And this beautiful panel here of experts, world-class experts, knows that, right? That you must have all of those pieces of the puzzle. And yet I realized I'd been set up for failure, and so many of us are set up for failure by our unconscious programming that we are taught, that we have to give until we're bled dry, that we have to be perfect or not show up, that we have to prove our worth through success. And then you add in trauma, our personal trauma that we are impacted by. How about our parents' trauma, our epigenetic trauma from our forebears that we now realize? And it's just a massive energy drain that really truly set me up for failure, to crash and burn, and set so many other people up. And that can show up differently for everyone. For me, it was losing consciousness while I was driving. It can also be, as so many have said here, it can be autoimmune conditions, it can be chronic pain, it can be diabetes, it can be heart disease, it can be cancer, right? All of the world's greatest killers are either exacerbated by or directly caused by chronic stress.
Exactly.
Sorry.
Exactly. In other shows and my other books, we have other experts talking specifically about PTSD and what happened when the trauma happened, and then you are trying to struggling to resolve the issue, but that comes with you in your cells, is gonna be stored. Because I had some trauma myself, like a car accident, and somebody threw me out of the car and trying to kill me, and this sin never gonna be removed from my brain. You may have some triggers, you may have PTSD, but as you said, if you try to find the connection between your body and your mind, then the recovery is going to be much easier. I'd love to have you in another podcast individually, Iren. Yeah. All right. Who else left here? Starpan, did you talk? Yes. Everybody talked? Yeah. All right. We still have few minutes left. So I love to hear some last words from any of you. Give some people who are struggling with chronic pain for years and they're not going to get rid of it. They think they're not going to get rid of it. So give me one sentence of hope. Okay, start. Yeah.
Well, it is my belief in learning about autoimmunity, which is really at the root inflammation. And a lot of people have chronic inflammation throughout their body. In the case of the people that I work with, it's arthritis, but it could be like Selena's son that has the type 1 diabetes, and it could be other types of chronic pain. But I think the biggest mistake that a well-intentioned mistake that the majority of us make is we want to go after the inflammation, and we think that that is going to heal our autoimmune disease. But it's very similar to the conventional approach, right? They want to give you a medication that's going to silence the inflammation. And then us on our natural side, we tend to kind of do something similar, and we want to prescribe diets and supplements that quiet the inflammation. But I want people to know that inflammation is information. It's our friend. It's that siren in our body saying, look, something is wrong here. And so for people to know that the root issue is something much deeper than inflammation. And if we look at the root cause of why our body's inflamed in the first place, then we can start to get to some real healing.
I'm going to dovetail right on that, if that's okay, because
yes,
inflammation
please.
is information.
Please,
that's beautiful. Like, because what we say is, no matter how common a symptom may be, it is never normal, right? It's always that check engine light coming on, and so many people with these over-the-counter medications, they just take a piece of tape and tape over that check engine light, right? And then we all know what happens after that. So, whether it's a chronic migraine or horrible periods or not being able to sleep at night or being moody and snappy with our kids and our partners, like, you need to dig, you need to look deeper.
Exactly. Thank you, Heather. Another good sentence from Kelly.
Sure. I'll just say some people have gotten themselves so deep into their chronic disease, chronic pain, whatever's happening. It's almost like I feel like I have no way out. And all I will say is when you're trying to look at going from here to here, right? It's too high. You can't see the top of the mountain. But you have to just tell yourself, if I just do one small step and one small habit, and it's those consistent habits over time that are going to really help you change.
Habits.
So, right. I mean, there's so many books out there on habits right now. But really it's your choice. And if you can implement one, you can implement another. But if you ever try too big, too fast, you're going to come crashing down.
Yes.
So just pick one small thing. And eventually you'll realize, oh, maybe it's not as difficult as I thought in this journey.
Okay.
I can also dovetail on that and say, like, you are not your disease. So I see a lot of people who are caught up in their, like, fibromyalgia, and that is their story. And so getting over the mind component for that, while diet is super important in all of the things we've talked about, like, there is a component of, yes, dealing with gut health, but like, you are not your disease, and that doesn't have to be the story and the way you perceive all of life. And that is a very important aspect that we do not address at all in medicine.
We have 3 minutes left from the first part. We have the second part with 2 more speakers. So if you want to leave, you can. But please, before leaving, give me your last word. Yeah, Salena, go ahead.
No, so for me, I just want to encourage any of those who have been searching for answers to believe your instincts. So I had my instincts squashed quite a bit from dealing with the infertility and all the health issues of my children, that to keep on searching and to keep nurturing that instinct and to not give up and to keep finding answers. There's a plethora of other practitioners like these here. Like, I wish I would have connected with just one of these during my journey. You can do it. So just keep on searching. I just want to encourage you that I believe in you, and just keep nurturing that instinct and don't give up on that instinct.
Thank you so much. Dr. Deborah Methew.
Yeah, I guess the message that I'd really like to make sure that people hear is that it's so important for each of us to take charge of our own health in the best way that we can. You can't wait for your doctor to fix you, because your doctor doesn't have pills that are going to make you well. They may have pills that can do damage control and help with some symptoms temporarily, but there's so much that we can do on our own, and living well is the best medicine.
Exactly. But there are some definitions in living well, right? So as I said, even if you have your diet or rest or whatever, you need to actually balance your life as well, as even for the PTSD emotional challenges you have. Everything should be in balance. We have Julie Olson here as well. Hi, Julie. I know she's waited there for a long time. Yeah.
Good to see you all. Thank you.
We are okay. Who else left? Okay, Daniel, your last word.
I think what I want to say, and I think the overall theme of this is there is hope. And I think that if you do your research and if you can go to the right practitioner, and a lot of times all of us here are probably the last practitioner that individuals come to. But there is hope.
Yeah, easy. Oh, where are you? You muted yourself.
Oh, there it is. It just muted. So what I was saying is that there's hope. There's hope. And, you have to find that right practitioner in order to help you out. Usually we're the last practitioners that individuals come to. I know I am in my practice. So, but once they come and we figure out what's going on, again, my wheelhouse is the lab testing, whether it's food sensitivity, whether it's a wheat zoomer, whether it's a heavy metal test, to see what's causing that root cause of that inflammation. And when I get very specific with the diet, I always have tissues in each of my rooms, because at one point in time, somebody's going to be crying hysterically, and I join in on the festivities, believe it or not, where I'm crying along with them because, they finally found something that they can do. But, somebody had said, I think it was Dr. Methew said that you have to take control of your health, and there's always hope.
Exactly. Thank you, Daniel. Now we're gonna introduce Julie Olson. I had interview with her. I love it. She talked about hair loss, because I know a lot of people have some challenges with their hair loss, right? Especially women, men also. All right, Julie, can you introduce yourself and say what you're doing? You're doing functional medicine?
I am. I'm a triple certified evidence-based nutritionist. I restore women's lustrous locks naturally by getting to the root causes of their health and hair loss so they look and feel the very best. And using over 10 years of experience in collaboration with functional and integrative practitioners, along with my training in functional medicine, I've transformed over 700 women's health and hair, and I create personalized health and hair rebuilding programs for clients that are realistic and sustainable for long-lasting results, which enables them to take charge of their own health. And I use the same strategies to personally overcome my health struggles with hair loss, digestive issues, autoimmunity, constant fatigue, and it's really inspired me to help women around the world do the same.
All right. Julie, here is a heater gray and a star pen. I don't know if you know them. Yeah, they are doing functional medicine as well. Star pen, you're doing the functional medicine, right?
I am a leaky gut health coach.
Oh, leaky gut health coach. I love to continue this discussion about the leaky gut if you have time. We still have some time. And I just want to know, why do you think leaky gut is really related to chronic pain?
Okay, so it is of my thinking, because I know it could be a controversial issue, especially when you're dealing with a conventional medicine. But it's my thinking that because of our lifestyle, not only the things that we eat, but just the things that we're even just exposed to via, let's say, our skin, even that being our largest organ. These things can cause hormonal imbalances, like we spoke about before, and it can cause the microbiome in the body to lose the proper balance that it was supposed to have. Because of that, I'm not a medical doctor. Educated and coaching people on this, but because of that, and in more of a layman's terms, over time, because the microbiome in the gut, especially because that's where the majority of our immune system lies, it becomes off balance. The healthy bacteria that is supposed to be surrounding the internal part of our gut and really keeping what goes in, it dissipates. It becomes, less prolific there. And because of that, the gut becomes permeable. And when that happens, all sorts of things can now make their way into the body's bloodstream and find lodging in tissues and organs in different places. So it is of my thinking that autoimmune disease is not your body overreacting to a healthy organ and attacking it. It is my belief that you have a healthy body which is appropriately reacting to an invader in said tissue or said organ and doing exactly what it's supposed to do and to rid your body of that invader. And that is what it's doing when we're seeing this inflammation in the body, very much like when our child has a fever and we say, oh, well, that's a good, that heat is good. That shows that the body's fighting that virus. And that, although we don't want chronic inflammation, because we know that can lead to so many health problems and can even be deadly, but it helps us to pinpoint and to identify just really why that inflammation is happening in the first place. And then when you realize the reason why, we don't necessarily need or want to go after each inflammation response, because we're just basically playing like a whack-a-mole game with inflammation. But if we really look more inward and go to why this has happened in the first place, which we mentioned started in the gut, and begin to seal off the entryway of those toxins so they cannot get into the bloodstream, that would be the very first thing and the most important thing that we can do to begin to address the autoimmunity, or what we'll call autoimmunity, because if there's this onslaught, if there's this outpouring of toxins into the blood, we're just chasing. We're chasing.
Hello.
So what I help my clients to do is to seal off the original, where the toxins are getting out in the first place. And then we start to rebuild and repopulate and do all those things. So that way, that inflammation response just won't be a response anymore. There'll be no need for an inflammation response because there'll be no invader for the body to attack.
Yes, thank you, Star. And you already talked about your last word, right?
What was that?
Last word?
My last word is that for moms who have children with autoimmunity, or really any kind of chronic inflammation or chronic disease, we are our child's best and only true advocate. And we really need to trust our intuition and trust our gut, pun intended, and really do the hard work that it takes to heal our child, because no medicine, no pill, and even the most well-meaning functional doctor, praise to you, is not going to be able to heal your child. As the parent and advocate, it is up to you to take the reins.
Thank you so much.
You're welcome.
We have Reed Davis. Is a bit like we waited for him, but I think there was some issues here. Was so busy. But thank you so much for joining finally, Reed.
Yeah, thanks very much. I liked what she was saying about that kids and being their advocate, and we are our kids' best advocate. It's wise advice.
Yeah. So Reed Davis now is a bestseller author. He has a very nice chapter in the Gap. And everybody read this book, love his chapter. It's very simple, it's very understandable, it's not very complicated. You guys can go and read it. And since I met Reed Davis, I started studying functional medicine, and I'm graduating now. It's a really great honor to see him and be familiar with functional medicine, because really functional medicine can save the world. That's what I'm saying. I know I already introduced you, but can you introduce yourself in few sentences?
Yeah, I'm Reed Davis. Best known for founding the Functional Diagnostic Nutrition Program and the Functional Diagnostic Nutrition Certification course, of which I see we have one of our graduates here, Heather. Hi, Heather.
How's it going?
And hi, Julie.
Hi there.
Hey, I'm just happy to contribute to anything that's going to uplift people and help them take control. The biggest thing for me is control. I don't know if functional medicine is going to save the planet. There's some things that it doesn't work on, like nuclear bombs, war and things like that. I mean, there's some pretty horrible stuff going on in the world. But I think if people did spend a little bit more time trying to help each other and sharing things that work for them, they might fight a little less. Certainly against the pandemic, I mean, that's a horrible thing that came along and kicked a lot of people's butts. Matter of fact, a lot of practitioners went out of business. They didn't know how to treat it, and unfortunately they were suppressed and not allowed to treat it, and lots of things like that are going on. So I think we have a good chance to continue to do good in the world. Thank you for leading the way on publishing the book, and for all the chapter writers. who contributed, and I hope people will get it, and I hope it will open up their eyes to working together. But I think the most important thing, my takeaway would be, you got to be in control of your own health. And just like that lady just said about kids, who's in control of their health? Well, their parents. And who's in control of the parents' health? They are. We are. We got to take control, because as soon as you put control of your health in someone else's hands, you're probably going to go downhill.
Exactly, I agree. Julie, do you want to add something?
Yeah, I was just going to say I'm familiar with, the functional labs that you run through your program. And it's so important to test and not guess. And those functional labs, they're not available to the conventional world. And that's what this whole book really explains. There's such a gap. And functional lab tests, Reed, that you train for in your program really are a really great foundation for that. I use all of them in my practice too. And it's
awesome.
Just having that data is so valuable.
I agree. And that's why we do it. It started back in the 1990s, trying a few labs, and, I had miracles occur. And again, I think you said it, doctors aren't running the same labs. Too many people are going to doctors and being told their blood work looks normal. Well, they know something's wrong, these people. And then what do they do then? When you have problems, no matter how vague it might seem or complex it might seem too, and you get told that your blood work looks normal, was it all in your head? No, it's not all in your head. There's something wrong, and you know it. So you've got to get into the alternative labs, the functional labs, and look for healing opportunities.
Right.
We're not trying to diagnose something that your doctor could diagnose. We're just looking for something that's out of balance, something that needs to be improved, whatever function it might be, and get that person involved. Again, we help people take responsibility.
Right. Even with hair loss, I mean, that you're going to see imbalances even on what, Reed? Well, I'm just saying, I mean, I deal with female hair loss, so
I'm teasing. I'm just kidding. Yeah. This has been going for 40 years.
You see imbalances even on regular blood tests. You can look at them functionally. You can see the imbalances years before it manifests. There's clues all over the place, but conventional doctors, they don't have the time, and nor do they want to even look at those functional levels.
Well, even when you get the levels done, though, this is what, sets FDN apart from so many other functional practitioners, because there's too many functional practitioners that are still just treating the paper, right? I think, like Pantia said earlier, you can't just treat the paper. You gotta build back up lifestyle. That's why they have a Dress for Success, protocol: diet, rest, exercise, stress reduction, and supplementation, right? So it's the whole picture, and tests are just a part of that whole picture.
That's so true. I mean, a whole part of it is I get a lot of people that don't even know they're out of balance, but they're not even absorbing their nutrients, which I find out from these functional labs. But how would they even know that if these labs weren't done? Because they think they are eating healthy, but they're like, the dress protocol, you have to look at, are they in the fight or flight? Most people are go, go, go in the fight or flight all the time. So how can they absorb their nutrients? It's rebalancing everything, not just nutrition.
I have a question from Reed Davis. Okay, these kind of supplements we use for functional medicine, how can we give it to our kids? Because there are so many of them.
Well, you have to start with the basics, and I got to preface that by saying that I left the environmental law field, conservation, in the late 90s and started working in the clinic because I became more concerned with people than birds and bees. And so, including myself, I didn't want anything sneaking up on me. I was healthy, but, and I found out people were really caught in a cycle of trial and error. most of our patients at the clinic where I started working had seen 6 or 8 or 10 different practitioners, and they weren't better yet. So I decided I was going to be the last person they needed to see. Pretty naive at the time, but I started doing 2 things. I took a course in nutrition, and I got to tell you, it was mostly about supplements, and I didn't like that approach. It wasn't really working. People would buy the supplements for a month, and then the second month they'd come back and they might buy them again if they were seeing some progress, but by the end of the second month, they'd all made up their mind. Either they're better and don't need to take them anymore, as if it fixed something, or they weren't working and they said it's not working, see you later. So supplements are not the answer, not by themselves. You can't use them to treat. We don't want to do allopathic supplements, allopathic nutrition. So, but they're part of a program because we need nutrients. We need vitamins and minerals and essential fatty acids and antioxidants, and we need the amino acids and trace elements and phytonutrients, and we need these nutrients genetically. They're required for really good, great function in the body of all thousands of metabolic processes and building tissue and functions. They need the nutrition. So you can't get it from food. Food's just not good enough anymore. The food that my grandfathers both grew up in Canada, you can't buy that stuff. It's you can buy organic, which is good. It might have a few more nutrients depending on the fertilizer, but mostly we eat organic to avoid pesticides and herbicides. So you're just not going to get it out of commercial food. So you need some extra vitamins and minerals and trace elements, and as the things I was mentioning. So first and foremost, and kids need them too. To answer your question, kids need that too. You can feed them all the great freshest vegetables and meats and eggs and all the things you eat that are good for you. There's a trick to getting that right too, but I think supplements are good. Vitamins, minerals, antioxidants at a minimum. And then we could go on about there what else we use supplements for.
When I read the course, they said mostly liquid, right? We should give to kids the liquid
Well,
supplement.
you're concerned with delivery. So delivery of vitamins and minerals could go a lot of different ways. And kids just don't really like swallowing big pills, so liquids, and there's other ways to get them into their powders, can go in their beverages. And even me, I don't like taking a big handful of stuff 3 times a day. I do it, but I also put as much as I can into my shake in the morning, little drops of this and drops of that. I look like the mad scientist in my kitchen. But
Me too.
yeah, really, but it works. As long as it doesn't blow up, you're okay, right?
Right.
But
I
yeah.
mean, most bottles have what are recommended for children, Pente, as far as what children.
Bottles?
Most supplement bottles, if they offer them for children, have the dose amounts, which are usually half or even less than half of what an adult should take, but it listed on the bottle of the supplement.
Mm-hmm.
And the other thing about supplements is they're so weak, so many of them, they don't have fairy dust levels of things that they claim to have. So I think buying really high quality, pardon me, but expensive, ingredients cost. So if you find cheap supplements, they probably don't have more than, again, I call it fairy dust levels of the nutrients that they claim to have. You look at the levels, you go, it's almost nothing. There's nothing in a lot of them.
Really?
So,
I agree. I mean, get practitioner grade supplements. So supplements you buy at the drugstore and stuff.
Yeah.
That's a waste of time and money.
Yeah. Yeah, they just don't contain enough. They make claims like they do.
But since they're not regulated, they can make claims all over the place.
Yeah, we call them truth claims. You just wonder how much truth is there. It's true. This vitamin does this, but you got to take 10 times what's in the whole bottle to get the effect, in a lot of it. So I don't make for supplements our first line of, it's just part of the program.
Yes, exactly, because you need a good rest and you need to take exercise. Whatever you eat, if you don't take exercise, it's not going to work for you.
Sure.
Yeah. All right. So we are very close to the end. If you have any last words left, please do.
I gave
Peter?
mine earlier.
Oh, you did. Okay. Read.
Oh, hey, as far as the gap goes, I mean, it's a good book. I think everyone should get a copy, keep it in your library, read it, and hopefully it'll be coming out maybe on audio or something like that. I would be willing to narrate my chapter. I don't know what's going on with the book.
Why
but
not? Yeah, we'll do that.
So we're trying to prepare you to deal with the world, and it's a pretty harsh one. And it's not getting better by itself. We have to get educated and work together to accomplish something and just to stay healthy. If you want to take care of yourself and your family and your friends and your coworkers, and especially for those of you who are in business, for people who are in business doing this, it's good to participate in something like this. I was very appreciative, but reading everyone else's chapter, realizing we're all really just trying to help people. It's a good thing. Get the book.
It's a very good book.
good.
A lot of great practitioners and really explaining that health is our wealth and there is a definite gap. And this book is helping to educate people about that gap and the steps they need to take to get healthy and be their own advocate. That's so important.
Yeah, I actually, my purpose is create this bridge. That's why we are writing these books, and hopefully I can actually continue this and having more authors, more healthcare practitioners or holistic medicine practitioners inside the book. Just create the awareness and give hope to others that even if you have chronic pain, is not the end of the road.
Absolutely.
Thank you so much, guys, for being here.
Thank
if you
you.
have anything, comments, anything to give us, please do. If not, then we say goodbye.
Thank you.
Bye, guys.
you.
Thank you. Thanks, Binta.
Thank
See
you
Julie
so
and Heather.
much.
Good to
Yes.
see you. Thanks.
Bye.
Bye-bye.
Bye.